Occupational therapy is a unique profession. You have to obtain a specialist training. Part of the things we do in particular is to support people's independence, achieving well-being in individuals. If you got the determination and the passion to support people, to make impact in people's real life, you will always find a place to work in adult social care. My name is Obi. I'm a senior practitioner occupational therapist working with East and South Within Occupational Therapy team. And I'm also an approved mental health professional working with the Mental Health Act team in East. The core part of my role, mainly I supervise occupational therapists and assistants. We call them OTS. The major part of my role actually is doing the duty role as a senior practitioner. That means screening referrals coming from Health and Social Care Connect, HSCC, Joint Community Rehabilitation Teams, coming from the GPs. As a duty practitioner, I can prescribe a minimal equipment to mitigate the risk before the case goes into our waiting list for an occupational therapist to pick up and go on a home visit. I also supervise the occupational therapy assistants in the clinics. We've got 3 clinics in the county, one in Lewis, one in Eastbourne, and one in Bexhill. When I'm running the team, or as a senior practitioner, I am responsible for every OT that goes out on that day in helping them make that clinical decision on complex cases and sometimes safeguarding issues as well. That includes screening, supervising OTs, monitoring their clinical reasoning form, and then having discussions on difficult issues. How the role of an occupational therapist plays out in a wider community, I would say, to promote independence, well-being, social interaction. If someone has what we call compulsive obstructive pulmonary disease, COPD, he came home one day, he couldn't go upstairs, bathroom is upstairs, no bathroom downstairs, toilet is upstairs, no toilet upstairs, and that's where occupational therapy comes in. And by the time we come in and do assessment, we might be looking at doing a minimal adaptation to the stairs or teaching him how to relearn the skill, to be able to cope, break down the activities so that he'll be able to manage again to go upstairs. And that enables the individual to go upstairs again, be able to complete his personal care, be able to maintain independence. And not only that, we are giving that person his dignity. Occupational therapists work in almost every department, be it in hospital, in rehabilitation, in private organizations as well. The best way to start is to have a chat with someone that is an OT already. That person is going to tell you what it takes, what skills you need, how you're going to do the training. And if possible, on arrangement, they can put you on a shadowing, an occupational therapist. That gives you a sense of what type of job we do and how we do it and what kind of expectations. That person is going to tell you what it takes in terms of academic requirements. You could go to the university and do a degree as an occupational therapist. If you got a degree already, but not in occupational therapy, you could be doing what we call the pre-registration master degree program, which is what I did. And that's a 2-year fast-track program. If you don't have the resources to pursue the university program, you could be looking for employment as an occupational therapy assistant. As long as you spend about 1 year working seriously, knowing what you're doing, or 3 years at maximum, then you can qualify to apply for East Sussex County Council to train you, and before you know it, you qualify. Have you got the passion to support people? Have you got the problem-solving ability? If you think you got that, and you think you can strive in that area, it's a good opportunity for you to speak to someone who is a qualified occupational therapist. It's a rewarding environment, and adult social care has great, enormous opportunities to offer. East Sussex County Council can support you to go through that process. So that's what makes that working in East Sussex County Council unique.